Hi everyone, my name is Zubair. I'm a nuclear medicine resident, and in my daily practice I meet many patients struggling with thyroid disorders. Because of how common and often misunderstood these conditions are, I decided to create a structured video series where I explain everything related to the thyroid gland, from basic physiology to disease processes and pharmacological management. You're free to watch the entire series in order, or simply select the videos from the playlist that are most relevant to you. This is the second video in a 4-part teaching series focused on the thyroid gland. In this session, we'll be discussing hyperthyroidism, specifically its causes, clinical features, diagnostic workup, and management options. Before we begin, it's important to clearly define a few key terms. Hyperthyroidism refers to a condition in which the thyroid gland itself is overactive, producing excessive amounts of thyroid hormone, leading to thyrotoxicosis. Thyrotoxicosis, however, simply means an excess of thyroid hormone in the body and does not necessarily require an overactive thyroid gland. For example, it can occur due to accidental or excessive intake of thyroid hormone medication. Hyperthyroidism is approximately 10 times more common in women and is frequently associated with autoimmune and endocrine disorders. The most common cause, accounting for over 70% of cases, is Graves' disease, where the entire thyroid gland produces excess hormone. This condition is caused by circulating antibodies that mimic TSH, leading to continuous stimulation of the thyroid. Graves' disease often runs in families and is particularly common in young women. Another cause of hyperthyroidism is the presence of one or more hyperfunctioning thyroid nodules. These nodules gradually increase hormone production, leading to elevated levels in the bloodstream. This condition is known as toxic nodular or multinodular goiter. Temporary hyperthyroidism can also occur in thyroiditis, an inflammatory condition in which stored thyroid hormone leaks into the bloodstream. Similar symptoms may be seen in individuals taking excessive doses of thyroid hormone tablets. Thyroid hormones regulate the body's metabolism, which is the pace at which many bodily processes occur. When thyroid hormone levels are elevated, nearly every system in the body speeds up. This explains common symptoms such as excessive sweating, palpitations, tremors, hair thinning, muscle weakness, and unintentional weight loss despite a good appetite. In women, menstrual cycles may become less frequent. Although patients often feel energetic initially, prolonged hyperthyroidism leads to muscle breakdown and fatigue, making tiredness a very common symptom. In Graves' disease, characteristic eye findings may be present. The eyelids can appear retracted, and in some cases one or both eyes may bulge. Patients may also develop a visible swelling in the neck due to an enlarged thyroid gland, known as a goiter. Diagnosis of hyperthyroidism is usually straightforward. Physical examination may reveal an enlarged thyroid, rapid pulse, warm moist skin, tremors, brisk reflexes, and prominent eyes. Laboratory tests typically show elevated thyroid hormone levels with suppressed TSH. Measuring thyrotropin receptor antibodies TRAb can help confirm Graves' disease. A thyroid scan is useful to distinguish between Graves' disease, toxic nodular goiter, and thyroiditis. Treatment options include antithyroid medications, radioactive iodine, and surgery. Antithyroid drugs reduce the thyroid's ability to produce new hormone and are often effective in controlling symptoms. In Graves' disease, treatment for 12 to 18 months leads to remission in about 20 to 30% of patients. These drugs are also used temporarily before surgery or radioactive iodine therapy in nodular disease. Mild allergic reactions occur in around 5% of patients. A rare but serious side effect is granulositis, a dangerous drop in white blood cells. Any patient who develops fever while on these medications should stop treatment immediately and seek urgent blood testing. Radioactive iodine therapy works by selectively destroying overactive thyroid cells. It is taken orally, absorbed into the bloodstream, and concentrated by the thyroid gland. Over time, hormone levels normalize, though many patients eventually develop hypothyroidism, which is an expected and manageable outcome. Surgery offers a permanent cure by removing most or all of the thyroid gland. It is safest when hyperthyroidism is controlled beforehand.